Hello and a very warm welcome to New Age Parenting. When we wait for a result, there is an apprehension. But when we get the results, there can be happiness and there can be at times sadness. But we would like to congratulate all the students who've achieved, who have attempted, and because attempt is a major aspect of one's life. Class 12th results are out, so congratulations to all the students and parents. In fact, we've always maintained that there is hope for everyone in this world. There are couples who've been waiting for the child to come in their life, but then at times they feel that it's not happening. In last couple of episodes, we've been talking about assisted pregnancy procedures. In this episode also, we'll try to explore some more procedures so that all the couples can be helped. Time now for an open soul searching. In our soul searching segment, once again we have the privilege to have Dr. Nandita Palshetkar, who is a famous infertility expert, has 20 years of experience and is also director at Leelavati IVF Center in Mumbai. A very warm welcome to the studios, ma'am. In fact, if we go back to the last episode, we had got so engrossed in the conversation. Of course, you talked about IUI, you talked about IVF, but we've also been wanting to know more about, are there different other procedures also which can be implemented in a couple's life?
Yeah, IVF was invented in '78, as I told you, and then came a major breakthrough in technology in 1992. Okay, that was when ICSI, that's ICSI we call it, in the colloquial language, was discovered. Here, one egg is taken, one sperm is taken, and the sperm is actually injected into the egg. So what happens,
outside or inside the body?
Outside the body, in the micromanipulator. It's using a machine called the micromanipulator. So the steps are like this: that the woman gets a period on second day of the period. We start with injections. The injections are given for 10 days, and 4 sonographies are done: day 2, day 8, day 10, to see if the egg is growing well. Egg grows at the rate of 1 to 2 millimeters per day. So when it's about 17-18 millimeters in size, we give the trigger. Now, as I mentioned before in the previous episode, that the trigger is given to rupture that egg. So in ICSI, we do not allow the egg to rupture. We go in and pick it out from the ovary before it ruptures.
The way you do it in IVF?
Absolutely. Similar technique. It's a 10 to 15 minutes procedure. It's with a needle and under ultrasound control. And the patient, the girl, goes home after 2 hours because there's no cut, there's absolutely no stitch. Now these eggs are taken into the laboratory. Now there comes the difference when you're doing ICSI. Here we dissect the eggs and we see if the eggs are mature. Not necessary. Sometimes, a lot of couples question me.
Dissect the egg means what? I mean, it goes under the microscope?
Yes.
Okay.
Actually, a lot of girls ask me, you're seeing 20 eggs on the sonography and you're telling me you got only 15. We may get 15, and out of 15, maybe 10 may be mature ones. As I said, we dissect. The egg is in a protective covering. Okay. And that's when we put enzymes to digest the outer covering.
Okay, so that it is able to come out.
Yeah, so then we see this egg and we see if it's mature. So only the mature, and this is a technical thing, it's called M2 egg. So if you have M2 eggs, those are used for injection and creating the baby. So previously in IVF, we used to just put the sperms on top and the sperm had to do the work by itself.
Okay.
But if the sperm was weak or the count was low, then IVF was not successful. So with this use of this machine called the micromanipulator, we actually take this weak sperm and inject it into the egg and achieve fertilization. So it was a real breakthrough in the treatment of male infertility.
And that is a big problem in India.
50% contribution is by the male factor. And in fact, we are lucky that now today the males are coming forward to do their semen analysis, getting tested, because a lot of times it's the problem with the male and ICSI can bypass it. You can have your own child very beautifully with using this technology. So once the egg is injected, it is kept in the incubator. Incubator is like your body. The temperature, the pH, everything is maintained so that the baby grows there. And then you get an embryo which is on day 2 or day 3 or day 5. we can transfer it back into the womb, and that technique is called embryo transfer.
Okay.
Now this is done without anesthesia. We take the patient on the table. Usually her bladder is semi-full. You know, we like a little bit of urine because that straightens the uterus for us, and then we can go and gently.
The path is okay.
Yeah, and plus we can identify on sonography. You know, we need the bladder to be a little bit filled with urine, and it becomes a very easy, simple embryo transfer is done. The lady goes home after 15 minutes on the table. You don't need to lie on the table for 2 hours. You know, this is very funny because I had a patient. She had done IVF 4 years ago. Her baby was 3 years old, and apparently, I don't remember, but 4 years ago we had kept her on the table for 2 hours. So this time she said, "No, I'm not going to get off the table." You know,
because I may not conceive. Yes,
exactly. So then we showed her literature and all. She got off in 15 minutes, and of course she conceived the second time also.
Okay.
So it's not that, you know, but 15 minutes is more than enough. In fact, a lot of research is now showing if you keep them lying down longer, the pregnancy rate drops.
What is the success rate of this?
See, IVF ICSI has a success rate of nearly 40 to 50% in women who are under the age of 35 years. Okay, and that pregnancy rate is definitely much improved now. Okay, but remember one thing, this is again a repeated treatment. If you don't conceive the first time, you should go for 2, 3, 4 attempts also. In fact, in good prognosis patients, what a good prognosis patient, young girl, you know, she has a infertility which is probably due to not producing eggs, sperm count is not too bad, and these are the patients where in 4 cycles the take-home baby rate is nearly 90%. Okay, but of course we tell the patients that they should at least attempt 6 cycles. But remember, there's extra technology which we are offering. If the patient has failed 1 or 2 cycles, then we offer them IMSI. We
when
offer
should be
them
the next cycle?
embryoscopy.
You know, suppose 1 cycle they have failed. How much time gap should be there for the next cycle?
Ideally, it doesn't matter. I personally feel it's the way you are physically. Sometimes you are physically, exhausted with the cycle, or mentally, or financially. So I think when all 3 are ready, it can either be immediately, or you can take a 2 months gap to recover.
Okay.
Some girls prefer to go back to back. You know, they feel that let us finish off with it.
Because it makes sense, you know, to inject the sperm in the egg. Because then it feels that the percentage would be, the probability would be more.
Yeah, you know, we were one of the first 5 people in the country to have started ICSI. It's a skilled job. It's technically very difficult. So probably not too many units are doing it because you need a very trained embryologist to do it. And I think today, as far as the data goes, I think 400 to 500 units in our country are definitely offering ICSI, maybe more also. But as far as I can recollect, at least these many centers are offering ICSI. And a lot of centers are doing only ICSI. You know, they don't offer IVF at all, or they don't charge differently for IVF and ICSI. So then, they do what is the best for the patient at that point. If you go as per, research, then ideally, if the sperm count is normal, you should do IVF 1 or 2 times. If the patient fails, then go for ICSI. But this is an expensive procedure, and forget the expense, even the psychological repercussions that are there for a negative cycle. I think, in our country we need to take practical decisions. So sometimes it's more sensible doing ICSI rather than doing IVF.
There are many more aspects which I wanted to ask, but there's one question which is coming to me, and I think a lot of people out there must be wanting to know that once we realize as a layman, that of course the egg and sperm are together, maybe through IVF, maybe through ICSI, whatever. So you say that embryo is formed.
Yes.
Then once the embryo is formed, then why doesn't it turn into a baby? What really happens?
I think that's a really good question, because all the patients say you formed babies. So why is your success rate not 100%? I think that's your question. There are a lot of factors involved. Okay, this is the first hurdle we've crossed by creating the baby. Then the next hurdle is preparing the uterus to be receptive to that baby. Okay, there are a lot of factors still unknown, and a lot of factors which are known. So we do our level best to treat the known factors. a lot of embryos may not be normal. Okay, so out of 10 embryos, maybe I have 4 normal embryos. So the rest of the 6 are not going to give me a baby. The 4 ones are the ones with the potential. So it can be an embryo thing, it can be even the uterus is not ready properly.
Dr. Nandita, yes, we have understood a lot about ICSI and IVF, and actually it gives us hope, because there are a lot of audience out there, a lot of people out there who really wanted to know and get into detail, because these are the things when they go to the doctor, they are not able to get the real answers. So we've been flooded with a lot of mails, and there's one mail which I wanted to take. She is Sunita from Bangalore, and what she says is that I had an IVF baby 3 years ago, and she's healthy. I'm very happy. It was very nice, but now I again plan to have a baby, and I'm planning to go for IVF. But only hitch, a fear I have, is that because IVF can have like twins or triplets, there is a probability, and can this be contained, and is it possible that I go for just one baby and not not twins?
This chance of having twins and triplets is about maybe between 10 and 15%. Okay. Now, especially Sunita, I think she's a fantastic patient to have. In our case, if it was Sunita, then probably Sunita would have had frozen embryos in the bank. I told you, we put in 2 or 3, if that gives a baby, the rest 5 or 6 or 8, whatever are ready, are frozen. They actually, the body temperature is 37 degrees centigrade, we take them to minus 196 and keep them there. These are kept in liquid nitrogen containers. So as long as you maintain the temperature, you can actually keep these embryos for 5 years, 10 years, 20 years also. So if a lot of my patients come back for their second transfer, so we remove these embryos. Now the question of having a single baby, I think, yeah, she has one child, so her fears are not unfounded that, she wants a single baby. Absolutely.
Now twins coming or triplets coming can be a tough decision,
So here we use a new technology called the embryoscope. Okay, the procedure is the same of ICSI. We inject the eggs, then these eggs are kept in this fabulous new incubator which has an inbuilt photography system. So time-lapse photography it's known as. So we set it, it's a computer thing, we set it to take pictures every 15 minutes. So we actually watch this egg fertilize and become an embryo. 2 cell, 4 cell, 6 cell. Yes, and you can watch the entire process for 5 days. And the time it takes from the cleavage, meaning it becomes a 2 cell to a 3 cell to a 4 cell, all those time frames are actually computed, and looking at those formulas we are able to identify the best embryo. And this embryo can actually, only one embryo can be used and put in a womb to give her a 40% pregnancy rate.
So no, what I wanted to, sorry, I'm interrupting because I really want to clarify. You said that ICSI is used on 3 eggs. Right?
No, we do ICSI on all the eggs that are there. So all these eggs are put into this incubator. And we watch it grow.
So anyone which has like the best
growth, there are parameters. Now I can't talk, they're very technical. So the computer helps me select the best embryo.
And then from the embryo, is it possible to understand whether it's going to be a single child or a twin or a triplet?
See, why do we get twins? Because we take 2 embryos and put it in the uterus. I'm going to put only 1 embryo. So the chance of that embryo twinning is pretty low.
Because I understand now. Like, let me frame it again, that in the usual IVF or ICSI procedures, what you do is, you put maybe, like you create different
2 or 3 embryos.
And then you put them back in the uterus.
2 or 3. Yes.
And then maybe, like 2 will become, and that is why they'll be twins.
Yes.
Or they can be triplets.
Or it can be a single. 80% of the time it's single, even though we put back 3 embryos.
Only 1.
Out of 10 patients, 8 patients will have a single baby. 2 patients will have twins. Probably. Triplets is really rare.
And in this ICSI procedure, what you do is you put just one
embryo. This not ICSI. She wants a single child. So then I will do a single embryo transfer.
And that is what the new procedure you did.
But how do we identify? See, that single embryo has to be good. So this is the technology where we identify the embryo with the best pregnancy potential.
Okay. And suppose this fails. Suppose.
Then we've got other embryos. No, we can keep putting single embryo transfers. In fact, in Europe now, it's compulsory to do single embryo transfer, because twin pregnancies causes a lot of preterm babies, a lot of expenses for the governments, because it's all funded. So single embryo transfer is the norm in Europe. So good prognosis patient, you cannot put more than one embryo.
Okay. And then now when you've put the embryo back in the uterus, when is the time, how much time does it take to understand that it can be, it will turn
Oh yeah,
into
we forgot about this. I think once we do the embryo transfer, after 14 days we do a blood test.
Okay.
And that test tells us whether the patient is pregnant or not.
So till those 14 days, the rest of the embryos will be kept there?
We keep the embryos frozen. I told you, vitrification. So we put them at minus 196 degrees.
Okay.
And I can keep them for 1 year, 2 years, 3 years, even 20 years.
Embryos also?
Yes, as long as the temperature, the way we did egg banking, you know, you can preserve the eggs.
Yes.
So that is how we do it. We take them to that temperature where all cellular activity stops. It's like suspended animation type, you know.
That, yeah.
And we store them.
We used to think about these things, you know, in those science fictions and everything, and it is becoming a reality. If we look at the emotional aspect of it, because that is the area which I think is least discussed in a few episodes also. I really want to know in which state the couple should be, the family should be, because at times even couples are not telling the families are not comfortable. And the biggest thing in Indian society is there's no acceptance of low sperm count in males, that males can have a problem is still a blockage.
In India, the whole concept of counseling does not exist. I mean, people would say, why are you sending me to a counselor? I'm not mad. You understand? That's the whole thing. So now people are more acceptable. We doctors do the counseling. A lot of times we are doing the counseling. But counseling has now become a specialized field. There are techniques, there are different ways to take away your grief. To take away that kind of a sense of loss that you feel by having this kind of a low self-esteem that you see. So counseling is really, really important, and the couple is offered counseling together as a unit, and I think it's very important to go together, and for the girls also to let out, to be heard, what are the fears, and the counselors do a dual job also. They explain to them what IVF is. There's so many fears about it, so that is really, really important. In fact, the ICMR is the body which is forming a law now for ART, and they have insisted that a counselor is an essential part of any IVF center.
Dr. Nandita, before we take your leave, there is something very important I wanted to know. Is that in India, how prevalent are these procedures? How much faith people have in these procedures, not only in the urban area, even in the rural areas, and how you people are reaching out? Because this is something which should be available to the common man. They should be made to understand that this is available and it is going to help them.
I think it's fairly common. Incidence of infertility in our country is nearly 10 to 15%. The problem is a lot of people are not aware. So I think that awareness needs to reach the grassroots. Though now there are centers all over the country. There are 1,000 plus probably centers in our country, and they are reaching out to people, and informative programs. I think information through written media, through electronic media is something where we can reach out to people, and they should be made aware that these technologies are available. You won't believe it, 20 years ago when I started, I had these two beautiful women come from Rajasthan, from a remote village for IVF treatment, and they were actually 45 and 47 years old, and they went back home with babies. I mean, they had just I don't remember now how they came to know, but yes, people do come even from villages, and the only thing is they have this fear of big cities. So you have to really handle them differently. I had to really take care of them like a child, guide them, tell them where to stay, what to do, literally. But the faith which they come with, it's amazing. I think that's really, really important.
And I can actually understand, after talking so much about these procedures, is that of course when the pain of not having the child actually should not be there. There's no need, because you can always try, because once you are in the procedures, there is hope and there are options available. Dr. Nandita, thank you so much for taking out so much time. Thanks a lot.
Thank you.